some students we have adaptive advices if they can't speak. They do have physical therapy equipment that they use to strengthen their muscles. Sometimes they have like balancing beams where they step up, they step down like steppers. They use the elliptical on the other side over there. She does different yoga poses with them because their joints sometimes can be a little bit thicker, so they need to be able to kind of move around. Depending upon their severity and their disability, some students, if they have a hard time walking, they might have braces, they might have wheelchairs.
Some of the organizations that treat Down syndrome are the National Association for Down Syndrome, the Dads Appreciating Down Syndrome, and the International Down Syndrome Coalition.
Can you tell me what Dimes for Downs does?
Okay, Dimes for Downs wants to help people have Down syndrome. We collect dimes and all different dime kinds of money.
What are we going to do with them once we collect the dimes? What are we going to do? What are we going to grant?
Wishes
And needs.
What kind of wishes do you grant for kids?
Okay, like probably Justin Bieber, probably Julie Andrews with the McIntyre.
What kind of needs do you have to help the kids out with?
We've done what? iPads?
Yes, we have iPads
And wheelchair strollers.
Wheelchair strollers.
And Gracie got a wheelchair.
And Gracie have a wheelchair.
It was a special wheelchair because Gracie had a stroke.
Yeah.
And she could only use one arm, so it was a one-sided wheelchair.
There's not one singular treatment. Treatments are based on person's physical and intellectual needs and personal strengths and limitations. Treatment can happen at home or in the community. Receive treatment from health professionals, physicians, special therapists, occupational therapists, and social workers.
In the USA, 367,069 people out of 29,655,405 people have Down syndrome.
Total number of cases at birth in Down syndrome in the U.S. increased by 24.2% from 1979 to 1983 to 1990 to 2003 in 10 regions in the U.S. The total number of cases of a disease in a population at a specific time of Down syndrome birth increased by 31% from 9 to 12 per 10,000 live births in 10 regions.
You can tell by this graph, as you get older, the more chance that you will have a baby who has Down syndrome increases. This table shows Down syndrome at birth per 10,000 lives, and the births were from 1979 to 2003. This graph shows the prevalence of Down syndrome among children and adolescents. So our Capstone group came up with 2 solutions that can help us help families who have children with Down syndrome. The first one is to create more organizations like Dads and Dimes for Downs that help kids who have Down syndrome or help any age who has Down syndrome. And they fundraise, raise money so they can grant their wishes and needs. And it's not always about just granting their needs, like yes, most of the time it is, but sometimes there is a special wish that can be granted for children who have Down syndrome. That'll make them so much happier and enjoy life so much more. Like for example, getting a trip to Disney World, meeting Justin Bieber. Our second solution is fundraisers, like Dimes for Downs and all these organizations do. They collect money so they can have the money to grant the kids' wishes and needs. It doesn't matter if it's one dime, it doesn't matter if it's $20. It could be $10,000 donation for this fundraiser. It doesn't matter. Every little cent counts. So our two solutions are one, making more organizations like Dimes for Downs and Dads, and two, having more fundraisers that raise money to help kids with Down syndrome so they can succeed in life or they can just become a better, happier person.